Welcome to the Explainer. Can a psychedelic mushroom actually unlock a depressed brain? Well, let's dive into the research.
Have you ever wondered why depression feels inescapable, like your mind is literally stuck on a rigid loop? Scientists call this brain modularity. It's basically a state where your brain's networks get totally isolated and stuck.
This rigidness leads to severe pessimism, zero mental flexibility, and those relentless negative thoughts you just can't shake.
So, the big question is, how on earth do we break these stubborn patterns and finally open the mind?
A groundbreaking Nature Medicine study tested a pretty unconventional solution, psilocybin, the active compound in psychedelic mushrooms. Researchers ran a strict trial, taking MRI brain scans of patients right before, during, and after their treatments.
They compared just 2 psilocybin therapy sessions against 6 full weeks of a standard daily antidepressant pill.
Okay, let's get to the results. Which treatment actually managed to break that stubborn cycle of depression? Both helped, but the psilocybin patients saw a significantly larger and much more sustained drop in their depression. Now, the real secret behind why this worked is right there in the MRI brain scans.
The scans showed global brain network integration. Psilocybin essentially helped those isolated brain regions communicate freely again. While standard pills left the brain networks rigid, the psilocybin physically unlocked and reconnected them. The data was crystal clear. A measurable increase in brain flexibility directly predicted that patients felt better.
So, researchers concluded that this global boost in brain connection is the key mechanism driving the therapy. It's kind of like turning a totally silent, disconnected office into a vibrant, highly collaborative workspace. And these network opening effects weren't just fast, they happened in a single day and lasted for months. To wrap up, psilocybin opens up those rigid brain networks way more effectively than standard daily meds. It's not a magic cure, sure, but this hard data represents a massive, fact-based leap forward. Will you support this exciting future of mental health research? Stay curious and keep exploring with us.